that's out within the community. We know today that in the region, not just El Paso, but in the region, Southwest region, that Omicron is over 90% of all the COVID-19 cases today. So that's really important that we know that it's more contagious, it spreads quicker, and as I see, and I'm talking to you on this now, everybody's starting to wear cloth masks because Dr. Alosi reported that that the cloth mask will not protect you from it, and I've noticed everywhere I've gone lately, everyone's starting to wear the surgical mask and the N95s, the K95s, and the 94s, which is the ones that were recommended for people. Now, today we have 8,088 active cases. I mean, we had, last time we talked, we had 8,000. Today we have 11,544. We had 368 people in the hospital. Today we have 553. We had 101 in ICU. We have 128. We had, and I'm gonna kind of go over it by the weeks. November. So this is very, very important to look at. That on November 11th, we were at 9.7% hospitalization rate. On the 15th, we're at 11%. November 22nd, we were at 13%. Then we had the holiday season, which was the Thanksgiving holiday. We were at 17%. And then December 8th, we reported 18%. Today, our hospitalization rate with COVID is 26.47. And that's something because this variant is so contagious and it spreads so fast. So we talk about wearing a mask, social distance, know your surroundings. So that's become very, very important. The number that's also that we want to talk about is, continue to get your vaccinations, continue to get your booster shots. But the breakthrough cases, week one was 5,017 new coronavirus cases. 2,681 of those were breakthrough cases, which is roughly 54% of the people that ended up contracting the coronavirus in week one were fully vaccinated. So again, it's important to make sure we continue to vaccinate, but it's important to know your surroundings. Some good news, though, that I'd like to share: the rolling 7-day average of positivity rate went down from 17% to this week to 12%. So I think that we're seeing, and it was reported by the AP News and the Dallas Times that in Britain that they've seen that it's the coronavirus is starting to peak, and I think we'll see the same thing in the United States. We still have weeks to come that we'll see where we'll peak, but right now it's really important to understand that in our region there's over 90% of the new cases are the Omicron cases. I do want to continue to share some important information that I think it's 5 and over, which is the number that we talk about that now is eligible for the vaccination. We're at 92.5% of our citizens are partially vaccinated. 74.8% are fully vaccinated. And our most vulnerable population, which is the one that we really focused on and continue to concentrate from day one, we're at 92.9% is fully vaccinated, and partially vaccinated is 99.9%. So if you're eligible for the booster shot, if you're eligible for the second vaccine, please do not miss that opportunity, because we're between 74 and 92. We're at 18% of the population still has not gotten their second shot or their booster shot. I do want to continue to make sure that we understand our surroundings, that we wear a mask, and like I said, I've noticed that everyone in here now is wearing almost everyone, Rick, is wearing the mask, the surgical mask, and it's important so we do not spread the virus. This is a team effort that has always been with the county, UMC, and medical providers. Now, these numbers that we provide and the numbers you see, there's a lot of people that are doing the home test, and the test is not reported. And when people do their own home test and they become positive, they do their own quarantine and they do what's needed to be done. But those numbers are not in here. So these numbers could be higher, but these are the numbers that through our medical providers, the city, the county, and these are the numbers that are being represented today. Again, I'd like to share the stage here with my good friend and the county judge that we've been able to talk, and this is why El Paso is really doing a lot better than most of the state, most of the country, because we've been able to unite our voice and talk in one voice. And if you see that we talked about the city of El Paso was at 92% first vaccine, the state of Texas only at 68%. And that's because we've united our voice and we've been able to thank our citizens. Really, our citizens are the ones that are doing it. They're going out there, and they're going out there to continue to do what's best for themselves, their family, and their coworkers. So I'd like to introduce my good friend and my partner that's really made this possible, County Judge Ricardo Samaniego. There was no applause, Judge. I don't know what happened.
Okay. Thank you, Mayor, and of course we've continued to emphasize this idea of the county and the city working together. There's an expectation that we could do more, and that's what we're at this point. We're working very close with Chief D'Agostino and Chief Rodriguez, especially in the rural areas. And as you know, we've got a lot of resources, but we're still struggling with personnel. We're struggling with volunteers. So conceptually, I just want to say that we have, we're understanding that we're sort of going down a little bit because of the, it's more contagious, but it's not as severe. We're keeping an eye on the hospitals, so we have a great relationship with the CEOs from the private hospitals as well as our county hospital. And so they're, they feel comfortable. We also have had an increase in going back on deaths, and we had quite an increase on the deaths. And people have asked me, are we prepared? And we are definitely prepared. We've learned a lot from the last peak, and we're doing everything that we can to help all the mortuaries. I want to focus, there was a time when I was really against this idea of coexistence, with the virus, because we didn't have our weapons. We didn't have the ability of vaccinating. We didn't have the ability of understanding what we were dealing with. And that's what people are talking around the country, and the way you could help us on coexisting with the virus is obviously the vaccinations, making sure you get your booster, making sure that you remain vigilant as to the surroundings, and learn as much as you can. Once again, we thank the media tremendously that we've been able to convey. This is very, very rare in any community that the media is helping us to convey the messages that they might not be getting because of broadband or other challenges. I want to talk a little bit also about this personal responsibility. When we talk about that phenomenon of having the home kits and not reporting, you do have the possibility of being able to call and say to public health, hey, listen, I tested positive, and I'd like to report that. And the reason that's important is because the mayor and I cannot work with not the right numbers. And the analogy that I've used is that it's like playing a basketball game without a scoreboard. I mean, you don't know what to do. You don't know if you're behind. You don't know if you're ahead. And so this phenomenon of self-reporting is very important. You're going to see that the results that happen are going to be the behavior of the community. If our numbers go up, it's a reflection as to whether or not we're understanding what we need to do. I also want to talk about not so much, I used to talk a lot about the bad actors, I want to talk about the good actors. Yesterday I had a long discussion with Dr. Heather Wilson about what they're doing, and it is so impressive. They're self-reporting when the students are not able to go to class because they have COVID. They report that. I've asked her to be sort of the benchmark for the other communities, or the mayor now will reach out to community colleges and the others so that we can have the right numbers. And that's very important that we do have the right numbers, because like I said, you're self-testing at home, and we need to find out what those numbers are. And so we have other CEOs, had an opportunity to visit Jolt Materials. They're at 93% of vaccinations. They've taken it upon themselves to do that kind of, having the events and the boosters and so forth. So one of the things that the mayor and I know for a fact is that a lot of it is going to fall on the hands of the community to do whatever they need to do. And that's going to be taking responsibility. And I've always said, if every CEO took responsibility for their organization, and every matriarch or patriarch within the family took advantage and said, hey, we're going to make sure this doesn't happen within our own families, that's going to be the result. And one of the things that we feel very proud about is that El Paso several times have taken the lead in dealing with very difficult situations. And so we're asking once again that our community take that lead and make sure that we become responsible, not only because it's our sort of like our flagship. We tell the world and the country that we know how to do it. And as I said, we're El Paso strong. We've earned the title. Now we have to defend it. Thank you.
Thank you. And one of the things, we have had some schools report that they have over 20% of the students that are currently not attending school because they've called in sick. I can tell you that we have 185,668 cumulative people that have tested positive. 703 were reported today. We have, like I said a minute ago, we had 11,544 currently active cases. Now, when we talked about, there was 92.5% of the citizens of El Paso have gotten their first vaccine. There's still 7.5% of the people that did not get the vaccine. And the county judge and I and the city leaders, our responsibility is still to them, to make sure that they stay healthy, make sure that we reach out to them. And we talk to them about wearing masks. That some may never get a vaccine, but our responsibility is to them. There's loved ones that we all love and care for that may not want to get the vaccine, but it's still our responsibility as a community to protect 100% of the citizens of El Paso. And with that, I'm going to open up to any questions. Yes, sir.
If you have questions, raise your hand and I'll get to you with this microphone because we're broadcasting live.
Thank you for taking time for questions. Mayor Lisa, I have two questions. My first one is the city facing a staff shortage with the rising cases?
I'm sorry.
Is the city facing a staffing shortage with increasing in new COVID cases?
Well, we are. We're making sure that we continue to protect our loved ones and our employees. So you're asking if we're taking proper procedures?
No, I'm asking if the city is facing a staffing shortage, like people city workers having to self-quarantine because...
Oh, absolutely. Absolutely. They, and that's what the judge was talking about when we're talking about, we were talking about sites for testing. We have plenty of tests. We can test, but the biggest issue we don't have personnel. People either have had the coronavirus, people are self-quarantining right now. So it's not about do we have the proper amount of tests. As you've seen, there's long lines, there's been a couple-hour wait. We do have the kits available, but the biggest issue we have today is that just what your question is, that we've had people that have not been able to go to work, and we've had a lot of staffing issues.
And so with the staffing issues, what is the city going to do in response to try and fill some of these vacancies?
Well, you can't, we're going to make sure we work with all our team members to make sure that they're healthy, make sure that they have the proper time to recover, and we'll continue to fill in and work for each other. And that's the important part, that they know that they have the proper time to either quarantine or to get better, because the city will stand behind them 100%.
Anybody else?
Hi, good morning. Primero, si pudieran dar un resumen en español de lo que acaban de mencionar. Y segundo, mucha gente tiene miedo a que volvamos a tener un retroceso en cuestión de cierre de negocios, cierre de escuelas y de la frontera. Entonces, ¿qué mensaje tienen para ellos?
Ok, ahorita no estamos viendo a cerrar las escuelas, no estamos viendo a cerrar los negocios, ni lo que estamos hablando es a la comunidad que nos pueda ayudar para hacer las cosas que necesitamos hacer, es la cubreboca, lavar las manos, la distancia, y ellos saben cuál porcentaje de personas pueden tener en el negocio. Fui a un restaurante hace como una semana y estaba hablando con un señor del restaurante y me dijo, normalmente yo tengo 68 employees aquí en el restaurante, ahorita nomás tengo 35, nomás puedo ahorita yo abrir medio para dar el servicio que quiero hacer. Ellos pueden ver lo que está pasando, ellos van a adoptar lo que necesitan hacer, y es la cosa que es importante, que no nomás la ciudad, no nomás las escuelas, solo los negocios tienen el mismo problema que tienen todos, que hay las personas que trabajan juntos que no pueden regresar al trabajo y tienen que tomar su tiempo para que se alivien. Pásale, por favor.
Sí, el resumen obviamente es de que nos tenemos que cuidar porque el virus es más, se desparrama mucho más rápido, no tan severo, pero nos causa muchos problemas. Estamos hablando de que nos faltan empleos, no hay bastante gente y todo eso tiene que ver, aunque sea leve, vamos a sacar a personas 5 o 10 días afuera del trabajo y nos está afectando muchísimo. Estamos viendo en el hospital que si llegara a tener un pico, es muy importante entender que si no va a ser cuestión de espacio, va a ser cuestión de personal que puede dar el servicio al paciente. Y eso nos puede afectar mucho porque también recuerden que hay lugares en el Estados Unidos de que están tratando a ver con quién vamos a tratar y a quién no, que es algo muy peligroso, comenzar a seleccionar a quién le damos servicio, a quién no le damos servicio, y no queremos llegar a ese punto. Pero ahorita más que nada es la responsabilidad personal de que cada uno debemos de tener precaución, de cada familia debe de cuidar a su familia, asegurar que todos estén vacunados, asegurar que están haciendo lo necesario. Estamos en un punto que no sabemos toda la trayectoria, nos puede ir muy difícil o puede bajar un poco, no lo sabemos en este momento, pero sí sabemos que se esparrama más rápido, pero no tan severo, pero el impacto a la economía es igual. Yo quiero, es difícil hablar de esto, pero ni el alcalde ni su servidor hemos hablado de cerrar negocios como parte de la estrategia, porque antes lo hacíamos porque no teníamos las posibilidades de la vacuna. Ahora si se vacunan las personas, no tenemos que hablar de cerrar, pero coexistir con el virus lo más posible. Pero no he escuchado que esa sea una estrategia, no queremos que se alarme a la comunidad a pensar que ya vamos a regresar a ese punto. Aunque los negocios, como dice el alcalde, muchos de ellos lo están tomando en sus manos. Por ejemplo, cierto, como el Outlet Mall no permite que entren completamente 100%, tienen filas esperando. Lo hemos visto en muchos lugares porque estamos más conscientes de que el negocio que cuida a sus empleados y a sus clientes son los que van a tener más éxito.
And I think that was a really good question, and I'd like to talk about it in English. And they were talking about, are we going to shut down businesses, or are we going to require schools to close? And the answer is, right now, we're not looking at shutting anything down. We're not looking at cutting down. As a matter of fact, businesses right now are self-implementing because they don't have team members. Half the team members have called in sick, or they're self-quarantining, and they're limiting the capacity. And I think you've seen that in even retail shopping, where they only allow so many people inside a store because they're limited to the employees that are coming in to work. So we're not looking at implementing any shutdowns, implementing any capacity limitations. And the county judge made a really, really good point in saying that the difference between today and a year ago is we have the vaccine today, and we didn't have the vaccine a year ago. And that's what's made a big difference in how we're able to move forward within our community. You have a question, Rick?
I understand how some of the city officials and the city employees are not wanting to get vaccinated, and so from what we understand, they're going to have them test weekly those that don't want to be vaccinated. Is there a similar situation here in El Paso where city employees or city officials are refusing to be vaccinated, and if so, what's the plan for them?
You know, right now we will continue to follow the law, and that's the important part, that we're not going to implement something that violates their rights and violates the law that is within the state and the U.S. So right now we'll continue to follow the law, and we know that people have rights, and we will respect their rights.
Real quick on the courthouse, just to differentiate, the difference in the courthouse is that the ability to mandate has been given to the Council of Judges, and so they're able to mandate masks, they're able to do other things that the community as a whole isn't able to do. So the Supreme Court has passed that on to Judge Chu and the Council of Judges, so that's why we can still mandate masks. Once they're in the courtroom, then every judge has the opportunity or the ability to say yes or no. In our case, it's 100% of the judges are aligned with a mandate of wearing masks. So you're going to find a little bit of a difference in that sense.
Right. And I think that's the same thing when you talk about private sector. The private sector has the right to mandate masks, and they have the right not to. Right now, you see a lot of the businesses, just about every business I walk into now requires people to wear a mask as you walk into their establishment.
Another question over here.
For the people who test at home, Judge, like you were saying, it's kind of like playing a basketball game without a scoreboard as far as you really don't know how many of those positive tests are out there if people don't report. is the county or the city doing something other than holding these press conferences and announcing the numbers that you do know, talking to the media every now and then? Is there something further down the line as far as a marketing strategy or some other technique in order to get that word out, especially for people to report if they do test positive?
I think this is probably the best forum. You guys have been incredible for us to get that message out there about being conscientious and and doing the right thing and being a good actor. And so we are, we've talked a lot about. We're working with a marketing company that's doing it in kind, and the mayor and I are looking at maybe PSAs, and we really have to keep that momentum going on the community understanding and allowing that. But the best examples are like UTEP's self-reporting and all the other schools. The schools do it almost by nature of what they have to do, that they get those reports. So we're trying our best to get the right numbers, but we still have the cooperation of the community to be able to succeed in that area.
And I think you all have seen where, I don't care where you go today, there is no self-testing. They're all sold out, there's none available, and you can go online and try to buy something, you're about 3 weeks out. So right now you'll see a lot of people that would like to self-home test, but walk in there, and right when you walk into whether any pharmacy or anywhere else, right there when you walk in the front door that says, we have no home testing whatsoever. That way you don't have to go in, you don't have to go through, because there's none out there available right now.
Another question over here.
Mr. Mayor, Judge, again, I was kind of specifically asking about the vaccines, not so much the masks. If someone is not vaccinated, will they be
No,
allowed?
I understood your question, and that was the answer was that we can mandate something that the federal law or the state laws do not mandate and do not allow us to do that, and we will follow and respect the rights of all our team members as mandated by law. No, I understood your question well.
Another question over here.
Sí, buenas tardes. Sabemos que cuando empezó la pandemia las fiestas se reducieron a gente. Si la gente continúa a hacer fiestas, ¿habrá otra vez esto de limitar la gente que esté presente para bajar los casos?
No lo oí, por favor.
La única manera que lo podemos hacer, dado las leyes y el gobernador no nos ha permitido, nos ha quitado un poco la autoridad de mandatos de que regresen a la casa. Todo eso tiene que ser ya parte de la familia decidir. El alcalde y su servidor pedimos que en Navidad a lo mejor dividir las familias, ¿verdad? Que en lugar de algo grande, a lo mejor dividirlas entre menos para que haya más espacio. El espacio es lo más importante. Lo bueno también, por ejemplo, los restaurantes, todos, casi la mayoría, cambiaron a tener algo en el patio y están utilizando más el patio. Como les digo, es una responsabilidad muy personal, más que un mandato de nosotros o del gobernador, es una responsabilidad de la comunidad.
Buenos días. Sabemos que últimamente pues, todos los sitios de prueba de la ciudad están pues, muy saturados. Hay muchas líneas y sobre todo muchos días de espera para los resultados. ¿Qué se está haciendo la ciudad? ¿Qué está haciendo para trabajar esta situación?
Sí, lo que estamos haciendo es que ya tenemos más planes. Nos está ayudando mucho Chief Rodríguez para comenzar a tener las pruebas en las áreas rurales. Si ustedes se acuerdan que estábamos muy central y pues batallaban para venir, ahora estamos haciendo todo lo posible para ir para allá. Sabemos que ir con donde está la gente es lo más importante. Entonces ya tenemos un plan, lo estamos manejando. Parece que esta semana iniciamos las pruebas en las áreas rurales, así como le hicimos con la vacuna. Y estamos trabajando muy cerca con la ciudad en tener las pruebas. Pero voy a hacer hincapié de que el falta de personal es el factor más fuerte que tenemos, no tanto que si tenemos o no tenemos ni la vacuna, tenemos la vacuna y tenemos las pruebas, pero el personal está muy reducido.
Lo mismo que él dijo. No, go ahead.
So from what you said, the numbers that you brought us earlier regarding vaccinations, we have a lot of people come from Mexico, family members and visitors getting vaccinated as well. The numbers that you provided, do they include the people that have come from Juarez get vaccinated, or how can we be sure that these numbers apply to El Pasoans?
Well, when people come across, they are required to be vaccinated. And, we have to rely on our federal courts and agents as they come across. And, we need to make sure that we take responsibility for our community, and that we need to make sure that we keep our citizens safe. So that's one of the things that's really important that we've done, is that as a community, we've vaccinated our citizens. We've protected the bridges as the federal government has required. And we'll continue to implement that again based on the federal government that says you have to be vaccinated to come through our bridges.
Any other question? More?
Si llegaran a subir los casos, o si llegaran a subir otra vez los casos, ¿tienen pensado a lo mejor cerrar otra vez la frontera o no se ha hablado de eso?
No, la frontera no es parte de nosotros, no es una decisión que se maneja mucho a través del COVID. A lo que sí quisiera decir que nuestra comunidad responde muy bien cuando sabemos que hay algo muy crítico, y les puedo decir que la cosa más crítica que nos está sucediendo ahorita es que los agentes de inmigración, los números se han desesperado con COVID, en los hospitales, los enfermeros, doctores. Llegamos a tener un punto de que si inmigración, pues ¿qué va a pasar? Pues van a reducir las líneas, ¿verdad? Si tenemos muchos casos, hay menos personal, el impacto va a ser en la frontera, pero que sea es algo federal, no del alcalde y su servidor, pero sí sabemos que están incrementando muchísimo con los agentes, y eso puede ser muy peligroso, así como en el hospital. I think in English, I'd say one of the things that I've said is that it's really, community response to when we get numbers are up or something. That I could tell you one of the tipping points that could be hurting our community is, one, our agents are getting more and more infected with COVID in the immigration agencies, which means that they'll reduce the bridges, so that's going to hurt our economy. We also know that in the hospitals we have less people working there, and we're burdening them. For example, if it's a ratio of 10-1, and one leaves, and that ratio comes now at 14-1, and that's a really difficult situation. So if the community wants to understand where the breakdown is going to be, is when we have less personnel in very, very key police officers, first responders, hospitals, and agencies. That could be very, very critical for our community. And when you have a spread like we do of this new virus, that's the danger.
And, to your question, your first question you asked about team members from the city calling in and being sick, and how we're going to do to cover for them. Well, just as the county judge was talking about, our medical providers, our first responders, they don't have the ability to work from home. They have to be out there. So it's really important that we continue to help them and wear our mask and continue to do the right thing, because our first responders, our doctors, they don't call in sick. That's not an option for them. They have to be there to provide a service, and they got to make sure that you and I and everyone in our community is safe. So that was really an excellent point, that when we talk about hospitalization capacity, they get sick also, and that will create a big burden within our community.
Some more questions.
With the numbers on the lines, is there any word on more antiviral medication coming in? Because I know we were out of it within the city.
What was that, Rick? I didn't hear.
More antiviral medication. After you've already gotten the virus, you get the transfusion, the antiviral medication that helps you beat the virus once you've gotten it, so you don't have to go to the hospital.
Well,
We were low on the stock, I understand.
well,
There you go.
yeah, we were challenged with that, but I think, Providence is doing an excellent job. They've opened more beds, and sometimes that's something that's less used than we'd like. And so it's not so much that we don't have it, it's a lot of people are not taking advantage of it. I know on the Alameda, our area there for the city, we're able to provide it. It's once again, somebody asked a question, we just have to get more information out there. Not everybody's getting the information, and I thank you guys always for this. This is probably the best way when the mayor and I are here to get that communication out, but we don't have other sources as well as we'd like to have that. But we're doing the best we can.
Well, there's that medication is available, and again, it's available at more than just the hospitals. It's emergency room providers that have it available. So it is available to the community, and at one point there was an article saying that we were running short, and we did, but right now we have plenty of it, and like the county judge just said, you know, we need to get our community to take advantage of it and use all the resources possible. Again, I want to thank you all for being here, and yeah, one more question?
One more question and we'll wrap it up.
Okay.
Mr. Mayor, this is my last two-parter question, I promise. So is it true that more than 100 El Paso Fire Department firefighters and 10% of El Paso Police Department police officers are on COVID-19 quarantine currently?
Well, you know, we do have quite a few of our team members, and, you know, we talked about that are out on COVID. So those are the ones that, you know, they can't work from home. They have to be at, you know, whether it's a police officer, a first responder, a firefighter, paramedic. They're out there every day, and they get exposed every day. So yeah, we have some of our team members that from the police department, the sheriff's departments, and the fire department that are out. Some of them are become positive, and some are, you know, because they've been exposed. So it's important that as a community we protect them as much as we want to protect our loved ones and our family members.
And can you confirm that El Paso Police Department officer died from COVID this week?
I cannot confirm that because I've not heard that. Okay. But thank you, though. Again, I want to thank everyone, and our responsibility, the county judge and I and all the elected officials, our number one responsibility is 100% of our citizens of El Paso. And one more life lost is one life too many, and we know that, and we understand that. So 92.5% of the citizens have their first vaccine, but 7.5%, which is loved ones, people we love and care for, have not been vaccinated. It's still our responsibility to make sure that they're taken care of and they're protected. So one more life lost is one life too many. Thank you, and may God bless everyone.